patient protection is important, but equally important is protection of the operator during radiograph exposures. What can operators do to protect themselves against unnecessary radiation?
Well, the same techniques you use to protect the patient will protect you generally. When you reduce unnecessary retakes, you reduce your own radiation exposure. Careful positioning, careful selection of the exposure factors, and proper film processing all reduce the number of retakes and therefore protect you as well as a patient.
Dr. Edmonds, are there any things that can be remembered for each exposure that will protect the operator?
Jim, if you think about TDS, the factors of time, distance, and shielding, and use these principles together, you can definitely minimize the exposure to the radiographer as well as to the staff. Remember, the time of exposure needs to be kept to a minimum. You need to maintain a large distance between yourself and the source of the radiation, and you need to place some shielding material between yourself and the source of radiation.
Would you break the various factors out and discuss them in more detail for us?
Yes, the principle of time has several implications. Somebody taking an X-ray should obviously minimize their time where they're potentially exposed to a radiograph. That's the reason that usually you're either standing behind a barrier that's in a room if you have to stay in the room where you're taking the X-rays, or if you leave the room, most of the companies provide a 6-foot or longer extension cord that you can run around the wall and stand behind the wall while you take the X-ray. You need to stand at least 6 feet away from a patient at a right angle to the cone when you're taking the radiograph. Again, make sure you're not using faulty equipment. If a cone moves while you're taking the radiograph, you may be walking right into the line of fire.
The 3 different objects, distance is one.
Yes, distance. You want to stay away from the open end of the cone as far as you possibly can. X-rays are kind of like light in that the farther away you get from the source, the less brightness that you're exposed to. Increasing your distance from the direct line of the primary beam is probably the most effective principle of radiation that you can encounter. Shielding is the other one. We've talked about time and distance and now shielding. As I said, the procedure that probably provides the most operator protection is one where you actually place a shield between yourself and the beam. This, in effect, places distance between you and the dental X-ray. Shields are usually constructed of lead or concrete barrier walls, but not always. So again, you have to remember to stay at a right angle to the film and to the beam and at least 6 feet away. If barriers are used, the radiographer has to remember not to peek around the corner and try and look at the patient while they're taking the radiograph. Hopefully, if you've positioned the film right, the patient's going to be comfortable and you can rest assured that the equipment's good, it's not going to move, you've exposed the patient one time only.
I'm sure the dental assistants come up with different challenges at different times. Do you ever have to deal with patients who you have to have hold the film while taking the radiogram?
There's some patients that are not able to cooperate. They physically can't support themselves. They may be too young to be able to hold the films in their mouths. So the young children, the elderly, the incapacitated, or the very ill are the ones that we have to work with. The radiation operator should never hold these films for those patients. We ask that the assistants come from their guardian or their parent who's come with them, and we actually ask them to sit with the patient if they can and put the apron over both the patient and the person holding the film, helping to hold it for them.
What about the pregnant dental radiographer? Are there any special considerations for her?
Well, if you become pregnant while you're employed as a radiographer, you first of all should tell your dentist so that the dentist is aware of that and he or she can review all of the radiation protection guidelines. If a pregnant dental radiographer performs the usual recommended procedures, they generally will not have any problems. The fetus will not get any extra radiation as long as they're standing behind the leaded wall, the things that Dr. Edmonds had mentioned earlier,